Hey, are you preparing for AMC Part 1 exam and John Murtagh feels overwhelming, confusing, directionless, and too bulky for you? This video is for you. Everyone tells us that John Murtagh is important for AMC, but when I started, I honestly struggled. It is too long, I found it hard where to start and what to read for MCQs and what topics actually matter for exams. There was no clear guidance, there were no clear YouTube videos, no simplified guidance, and no exam oriented approach. Reading the book felt scattered and time consuming. So I decided to create what exactly I wished existed when I started preparing. On my YouTube channel AMC Prep Talks, I created a playlist called as John Murtagh Simplified, which is especially for AMC MCQ aspirants. So I have covered the section 3 of 8th edition of John Murtagh, that is presenting symptoms. Each video contains focuses on common complaints that are tested in AMC exams. For each common presentation, I have started my video with the diagnostic model, which is given by the John Murtagh, and it is basically for you to make it easy to approach every common presentations, some of the common disorders and probable diagnosis that may come to your mind. Then comes the serious disorders that cannot and we should not miss. Then comes the pitfalls, the disorders that often get missed, and then we have seven masquerades, which contains diabetes, depression, spinal dysfunction, UTI, drugs, and toxins, and other psychological disorders. So this is the diagnostic model. I have started my videos with this diagnostic model to just to give an overview to you about the common presentation, what disorders can come under the come under the heading of the common presentation. For example, back pain. By starting the video with diagnostic model, I actually wanted to make it easy for the students that are going to attempt the AMC clinical exams. They can get the benefit from the diagnostic model. Then I have covered the most important topics and most important fields that AMC likes to test you on. These are differential diagnosis, stepwise approach, red flags, which are the very, very, very important. And you cannot miss it. The key differentiating features, diagnostic triads, they also help you to identify certain disorders, important flow charts, and referral and urgency points. What are the points and what is the level of the disease that you now you have to refer the patient from general practitioner to the specialist, and then what the AMC MCQ focuses on. So actually the section of common presentation can be considered as the gold section of John Murtagh, where you can find many disorders regarding the common presentation, and this is high yield for AMC. It is especially helpful if you are just starting your AMC preparation, whether it is AMC MCQ exam or a clinical exam. It grabs your hand when you are stuck with John Murtagh, and it can also be used for the last minute revision where you have not much time to go through detailed sections. Now we are going to take an example, and we are going to apply all these things that I have covered in the video on an example of chest pain. That is a very high yield topic for AMC exam. We are going to make the diagnosis by seeing differential features and keeping in mind the red flags. The most important thing in any case that is coming in the MCQ. A very, very important point that you should not miss is that the AMC wants you to never miss the serious disorders and danger signs. In any case that is presenting to you in the form of MCQ, they want you to first rule out the serious disorders by looking at the danger sign. So, whenever the question comes up, first you have to look for the red flags. Red flags can be the age of the patient, can be some serious signs and symptoms that the doctor sees in the patient, and the serious symptoms that are experienced and told by the patient. So let's start with that. Starting with that, we are going to apply this. So if the patient is coming to you with chest pain and he is complaining of the pain in the jaw, or left arm, and specifically the both arms. Both the pain in the both arms is highly specific for acute coronary syndrome. So pain in the jaw and left arm is the red flag. Is considered the red flag in the section of chest pain, and we will suspect acute coronary syndrome and acute MI. So if the patient is coming to you with chest pain, the very first diagnosis that can come to your mind is acute MI or ACS, and you have to rule it out first by doing the ECG, because it can cause sudden death. So that's why it's very important to rule out at first, and it is very common in our population. Then comes this: if the patient is having sudden severe tearing, thoracic, that is retrosternal pain, inequality of pulses, and pallor, we can say that the patient may be suffering from aortic dissection. So the red flag here is that the patient is having thoracic back pain, and on examination, the patient is pallor, and inequality of pulses is also a red flag. If the pain is localized and sharp and it is aggravated with inspiration, with inspiration, it is a red flag, and it points toward the pleuritic kind of pain. Pleuritic kind of pain can be multiple reasons in pulmonary diseases. So if the chest pain is aggravated with inspiration, it is likely to be pleuritic. The patient is having acute chest pain, and he's having a sudden shortness of breath, and he has recent immobilization. That is, he has a recent history of long hour flight or travel, and he has undergone a major surgery, and he has also a history or risk factors for thromboembolism. We can suspect the pulmonary embolism. If the patient has sudden onset of shortness of breath and chest pain, and he has a history of trauma on chest, or he has a history of some pulmonary diseases like asthma, COPD, pulmonary disease, we can suspect pneumothorax. In case of trauma, the pneumothorax would be tension pneumothorax. In case of secondary pneumothorax, like if the patient has predisposing pulmonary diseases, the pneumothorax would be spontaneous. Now, if the pain is increasing with bending or after meals and at night, we can rule out the acute coronary syndrome, because acute coronary syndrome is very unlikely presents with this type of presentation. And if the chest pain is associated with these symptoms, we are going to suspect gastroesophageal reflux disease. So these are some of the these three are originating from esophagus, and the differentiating features are written here. So you can apply the differentiating features in here. So if the patient is having acute, sudden, severe pain, and it is especially after the endoscopy, patient has recently undergone endoscopy, and he has a severe pain, we can suspect the esophageal rupture. If the patient has taken a very hot or cold food or drink, and he has experienced pain in the chest, and you give the nitroglycerine by suspecting that it may be the cardiac origin, pain of the cardiac origin, and it gets relieved by nitroglycerine, we can suspect a spasm. Keep in mind that the pain of angina is also relieved by nitroglycerines. Not all the time, but most of the times, if it is not so severe. So it can be relieved by nitroglycerine. But the differentiating point from esophageal spasm would be that the patient has a history of hot or cold food and drink. Whatever the differentiating features, whatever the red flags are here of the chest pain, first we are going to rule out the acute coronary syndrome by doing the ECG. You have to keep in mind this. So by John Murtagh, we have learned the approach to the patient, differential diagnosis, red flags, diagnostic type, basically the approach to the patient, and how we are going to differentiate some disorders with the others. But the main role of the main resource to pass the AMC exam are the guidelines. From guidelines, we will focus on management. We focus on the management basically. So the guidelines are main, and they play a very big role in the AMC exam. but the John Murtagh teaches you how to approach the disease and how to approach the case and how we are going to see the case. First, we have to rule out the red flags, serious disorders by seeing the red flags. Then we have to look for the differentiating features and all of that. So, if this sounds helpful to you, please make sure to watch the playlist and like and subscribe the videos and channel. I hope it saves your time and makes your AMC preparation less stressful. So good luck and study smart. Thank you.